The CDC has a lot to say about you.
They sure do.
Yeah.
I digress.
It's not great.
No, never is. Never is.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Thank you for joining us for another new episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Michael Squires.
In today's episode, we'll be talking about all things congenital hearing loss related, inspired by the article written by Dr. Jacoby Davis of Fort Bend Hearing in Houston, Texas. This can kind of be a very heavy, very involved subject, but it's extremely useful. And that's why we tapped the guy who has 3 kids of his own to lead us through this maze of information. So, Dr. Michael, let's start this voyage. What is congenital hearing loss?
Yeah, so I want to start this voyage by saying, excellent article by Dr. Davis.
Cool.
Like, really, really good article. Very in-depth, and I don't know that we're going to have the time or bandwidth or energy to cover everything she covers in that article.
You speak fast, so we have 10 minutes. I have faith in you.
Oh, good. Congenital hearing loss is a hearing loss that's going to be discovered at birth. All states have an early hearing detection program, right? And part of that, they're going to have newborn hearing screenings. Okay. And so as a result of that hearing screening, that child, that baby, should be screened within a couple days of birth. Got it. And that's the general protocol. Sometimes if that child ends up in the NICU, neonatal ICU or anything like that, sometimes they will rescreen them just because of the circumstances, right? Or they'll get to the screening later. But regardless, before that baby leaves the hospital, at whatever time frame that looks like for that family, that child should have been screened for hearing loss. And so
is that that's mandated by the state for the child to have a hearing loss exam or a hearing exam rather?
Yes.
Okay.
So that is something that needs to happen.
Okay.
And then unfortunately, what ends up happening is loss to follow-up in some of those cases.
Got it.
So there are certain agencies in certain states that oversee that program. And then in some states, they just don't have the oversight that they have in others, right? So I've practiced in Ohio when I was doing my graduate work. They have a very strict oversight process. I'm in West Virginia right now, and it's less of a strict process, okay?
Got it.
And so what we find locally to my clinic is that I see a lot of loss to follow-up. I'm very lucky in the sense that I work very closely with ear, nose, and throat physicians and otologists and primary care, pediatricians, I guess in this case, and that I get a lot of them on the back end. But I still discover a lot of hearing losses in primary school. Yeah. So I'm getting a lot of kids in 2nd, 3rd, 4th, 5th grade that they have a hearing loss that's been untreated for who knows how long, right? Yep. So there's a lot of importance in that early detection because when you have early detection, you also have early intervention.
So I have a list of the really early from birth to 3 months, kind of the things to look for, right? So if we're talking really early on, so newborn to 3 months, which I guess would still technically be a newborn, reacts to loud sounds with a startle reflex, is soothed and quieted by soft sounds, turns head to those speaking, wakes up when there are loud voices, sounds, smiles in response to certain voices when spoken to, seems to know parent's voice and quiet sound of crying. These are what we're looking for if everything's kind of hunky-dory.
Yes. Okay. So for any parent that's watching who's going, I wonder if my child has a hearing loss, right? That child most likely was screened at birth, right? So at birth, if everything was normal, that doesn't necessarily mean we're all finished, right? So the CDC puts into place these developmental milestones, right? Yeah. And there are developmental milestones for all things life related, right?
What about 38-year-olds who host podcasts?
Yeah, well, the CDC has a lot to say about you.
They sure do.
Yeah.
I digress.
It's not great.
No, never is. Never is.
No. So when we're talking about kids, we're talking about congenital hearing loss. I recommend that all parents go to the CDC's website or just Google it, CDC developmental milestones or developmental milestones for hearing. Or go to a pediatric audiologist and ask them for a printout or some information about these milestones so that you can be aware of what to watch for, especially if it's your first child. Yeah. I know from experience, the first diaper that I ever changed was on my newborn son. And it's a scary time. We're learning lots of new things. We're seeing and smelling lots of new things. And, it's just a scary time for a parent.
Absolutely.
By the time you get 2 or 3 kids deep, you start to get the hang of it.
Yeah. There's a rhythm to seeing or not seeing certain things in your children.
Absolutely. It's also really important to realize that from birth, most of these kids, although they have developmental milestones set in place, things that we need to watch for, they're all individuals, right? And so some kids, they start speaking a little bit later than others. Girls have a tendency to go a little bit sooner. I know that because I have a 4-year-old daughter that opens her mouth before she opens her eyes in the morning and closes her eyes before she closes her mouth at night. However, we need to kind of have these in our mind as a guideline so that we can, just do the best that we can for these kids.
For sure.
And if there are any concerns at all, make sure that we are following up with our well child checks, making sure that we're talking to our pediatricians and the nurse practitioners in our pediatricians' offices about these milestones and what to expect. Yeah. And if there is truly a concern by the parent or the guardian or grandparent or whomever, get that child into a pediatric audiologist, somebody that is specializing in pediatrics who knows what they're looking for and who can do the proper testing and follow up. There's a lot of skill that goes into testing babies. Yeah. Only a few tests that we use that don't require a response from the babies. We're testing tympanometry. We're making sure that the eardrums are moving the way that they're supposed to, that there's no fluid or ear infections that are starting early on. We're looking at something that's called distortion product otoacoustic emissions. These are just little sounds that we're waiting for. We put 2 little sounds in the ear. This is the most basic I can explain this. We put 2 little sounds in the ear, and we wait for a little sound back. And that's called a distortion product. The cells that are responsible for hearing are going, hey, we're good, right? And so we're monitoring those, or we're monitoring brainstem activity in response to sound. It's an auditory brainstem response or an auditory steady state response. And it's the diagnostic testing that the pediatric audiologist is doing that can really check that box for you.
So I talked about infants real quick. I just want to address, from like 1 to 2 years old, this quick list follows one-step commands when shown by a gesture, uses words she has learned often, uses 2 to 3 word sentences to talk. Obviously, your kids have no problem with that. Say more words as each month passes, points to some body parts when asked, understands simple yes, no's, enjoys being able to read, being read to, not being able to read, being able to be read to, could be, genius, chooses things by size, big, little, and follows 2-step commands, get your shoes on and come here, stuff like that.
Yep. So I like to, in the very, very basic form, and this doesn't follow exactly the CDC's milestones, but in the very basic form, 1 year, 1 word, 2 years, 2-word sentences, 3 years, we should be putting multi-word sentences together.
Got it.
I had a 3-year-old that would just go on and on and on, stories out the wazoo, and very descriptive. And some 3-year-olds just don't do that. Right. So everybody's really pretty different in their development. But they should be seeing progression, right? I never like to ask a parent how many books they read to their child every day and have a parent look at me and go, I'm supposed to read to my kid? That's happened. And that's the opposite of what we want, right? We want to be fostering progression or progress with these developmental milestones. And you can do that by making sure, like I said, appropriate follow-up with the pediatrician and making sure that you're seeing progress in speech and language development, their attentiveness to you, making sure that the TV's not at full volume in order for them to be able to hear it, monitor screen time. I'll just throw that in there. But, we want to make sure that they're progressing in a normal way.
So kind of as we wind this episode up, obviously we could talk about this forever. For a very, very long time.
This Go to that article.
Yeah, this could probably be its own podcast where we could talk about a new element of congenital hearing loss. But I think what I hear you say is, A, be hypervigilant as a parent to understand your child better than most and take them to a physician should something arise that seems
it just seems off,
out of place. And then trust the provider, the physician, to be able to come up with the best treatment plan for you and your child.
Yeah, absolutely. And work with an audiologist. If we're talking hearing, a pediatric audiologist is where you need to be. Right? Your speech pathologists are great resources as well if your child is in a speech program. But of course, we're talking congenital. We're talking at birth. We need to kind of separate our mind from progressive hearing loss or something that is acquired that happens later on, which can happen in childhood. But with congenital loss, we're talking infants.
Got it.
And so just be hyper vigilant of those CDC guidelines in terms of milestones and what to watch for. And just report to your pediatrician any issues that might arise and get a referral to an audiologist.
So to learn even more about congenital hearing loss or to read this article, feel free to visit askanaudiologist.com. Dr. Michael, great job today.
Hey, thanks a lot, Kevin. You too.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
I feel like we're in one of those medication commercials where it's like the brand new Falorfa, live your best life. Can cause hearing loss, deafness, sudden hearing loss, all this. Like, okay, I don't know that my IBS is that bad that I want to lose my hearing.